Hi, I'm Dr. Peters. This week's quick video is going to be on utilizing the foam roller for the lower leg. So when we talk about the lower leg, we're talking about basically from the knee down, and we're going to talk about the medial portion. We're going to work on the anterior tibialis muscle, and of course in the back we're going to work on the posterior tibialis, and we're working on the peroneal muscles on the outside of the leg. So again, this is meant to be quick, just an introduction to how to do this. You know, is there a right way and wrong way? You know, it's not so black and white. Just get on the foam roller and start playing around with it and figure out what really works good for you. But let's cover the lower leg. First, real simple, just gonna kneel on the foam roller, and you're gonna do the front of the legs. So this, I mean, again, for some people, certain knees will be painful, and you can just modify it to what works for you and work your way up. So we're going to kneel on it, come forward, and we're just going to roll just like this. So very simple, very easy. Now, if that's tender, that's a good way to do it. If that area is not so tender for you, well, put your body weight over it. Get up on top so you have more pounds per square inch of pressure on the myofascial as you roll. So getting your body upright, rolling back and forth this way. And if you have areas that are a little tender, stay on top of them. Go back and forth slowly and work that tenderness out. I tell people 30 to 60 days of doing this full body where you should be feeling really no pain as you're doing it. Unless maybe you just did a leg workout and they might be a little more sore. So working the front, going back and forth. And again, maybe it's tender or maybe you have a shoulder issue. Well, then get down on your elbows and roll this way. So there's so many different ways to do it. Just make sure you're getting over that particular area. Next, let's go over the medial compartment. So we're going to do the inside of the leg. So if I angle this way, hopefully you can see this well. I'm going to get on the foam roller, but instead of staying perpendicular to it, I'm going to roll in so the medial compartment is facing the foam roller. Now, initially, let's say it was really painful. You might just roll real light and easy like this, just going back and forth. So as that gets easier to do, what I want you to do is put more and more pressure into it. So you can put your hand and push down while you're rolling back and forth so you can get in there better. And don't miss any of the areas. You want to go all the way up and down, all the way up and down, and look for those painful spots. And as far as the lateral compartment, for the different muscles on the outside of the leg, roll the leg out so that you're hitting the outside. And this is one of my favorite ones to do because the peroneus tertius and longus and brevis are here on the outside, and I find that a lot on patients coming in. So let's say it's really tender. You know, maybe you're just going to roll this way, not put a lot of pressure on it. Once it's doing better and you can put more pressure, come up on it. Again, my foot is turned this way. I'm going to put my other leg up on top of it, and I'm going to bring my body up over it so I'm putting more downward pressure, and then I'm going to roll back and forth like this. So you can put as much pressure on it as you want to, and just roll up and down and work out those painful areas. So, and for some people say, oh my gosh, I can't sit on it, I can't get down on the floor as well. There are other products out there. The Intracell stick, I love these, especially if you're a runner traveling around the country and you're doing these marathons. The stick is very portable. So talk about doing the back of the leg, how easy is it to do this? But right now I just want to utilize the foam roller and talk about how valuable of a tool it is. Starting here in the lower leg, then we'll work our ways up to the knee, to the hip, doing the shoulder, doing the back area. So that's it for this week. We'll see you next week.